What is aminophylline?
Aminophylline is a 2-to-1 ratio drug combination of theophylline and ethylenediamine. To alleviate symptoms of reversible airway obstruction due to asthma or other chronic lung disorders such as chronic bronchitis and emphysema, it is FDA approved.
It is also used in preterm infants to avoid apnea. Aminophylline uses.
Aminophylline is used to prevent and treat asthma, chronic bronchitis, emphysema, and other lung disorders caused by wheezing, shortness of breath, and trouble breathing. It relaxes and expands air passages, making breathing easier in the lungs.
In premature babies, aminophylline is also used to treat respiratory difficulties.
Speak to your doctor about the potential threats to your baby's condition from taking this drug.
Often, this drug is prescribed for other uses. Request more details from your doctor or pharmacist. How to use aminophylline drug.
Aminophylline is available as an oral tablet, syrup, and rectal suppository, typically taken every 6, 8, or 12 hours as prescribed.
Follow the instructions on the prescription label carefully. Consult your pulmonologist or pharmacist for clarification.
Take aminophylline tablets or syrup on an empty stomach with a full glass of water, at least 1 hour before or 2 hours after meals.
Do not chew or crush tablets, swallow whole. Aminophylline manages asthma and other lung diseases but does not cure them. Follow your doctor's advice even if symptoms improve, and consult before discontinuing. Steps to implant a rectal suppository. Get the wrapping off. Dip the aminophylline rectal suppository tip in the water. Lie down and bring your right knee to your chest on your left side. A left-handed person should lie on the right side and lift his left knee.
For a couple of moments, insert the suppository into the rectum using your finger, roughly 1/2 to 1 inch, 1.25 to 2.5 centimeters, in infants and children, and 1 inch, 2.5 centimeters, in adults.
Stand up after 15 minutes, roughly.
Wash your hands and resume your daily activities.
Side effects of aminophylline. Here are a few side effects of aminophylline medicine that can be taken care of at home. Upset of stomach. Stomach pain. Diarrhea, infection. Headaches. Inquietness. Sleeplessness. Irritability.
We suggest contacting a doctor immediately if you encounter any of the following symptoms.
By vomiting. Rapid or elevated heart rate.
The irregular beat of the heart.
Convulsions. Rash of the skin.
Other rare side effects.
Chest pain or discomfort. Dizziness. Fainting. Fast, slow, or irregular heartbeat. Increase in urine volume. Lightheadedness. Persistent vomiting. Pounding or rapid pulse. Seizures. Shakiness. Overdose of aminophylline has the following symptoms: pressure in the abdomen or stomach, vision blurred, uncertainty, confusion about identity, place, and time, dark-hued urine, the decrease in urination frequency, reduced urine, diarrhea, infection, difficulty passing urine through, dribbling. When standing up suddenly from a lying or sitting position, dizziness, faintness, or lightheadedness. Dry mouth. Rapid, pounding, or erratic pulse or heartbeat. With fever. Enhanced hunger. The irregular beat of the heart. Appetite loss. Changes in mood. Cramps or spasms in the muscles. Pressure or weakness of your muscles. Sickness or vomiting. Nervousness. Tingling or numbness in your palms, feet, or lips. Arms pain and discomfort, jaw, back, or neck pain or discomfort. Painful urination while urinating. The shakiness of the legs, hands, arms, or feet. Breath shortages. Sweating. Uncommon exhaustion or weakness. Vomiting of blood or coffee-like substance. Precautions to take before using aminophylline. If you are allergic to any medicine, notify your doctor or pharmacist. Let them know what prescription drugs you are consuming in the list below. Azithromycin, Zithromax. Diuretics, water pills. Carbamazepine, Tegretol. including allopurinol, Xyloprim, cimetidine, Tagamet, ciprofloxacin, Cipro, clarithromycin, Biaxin, erythromycin, lithium, Escalith, Lithobid, propranolol, Indirol, phenytoin, Dilantin, oral contraceptives, prednisone, Deltasone, oral contraceptives, Dilantin, rifamycin.
Also, tell your doctor and pharmacist what non-prescription drugs and vitamins you are taking, especially
ephedrine, epinephrine, phenylephrine,
phenylpropanolamine or pseudoephedrine containing non-prescription medications. These medicines, e.g., diet pills and treatments for colds and asthma, are used in many non-prescription items, so check the labels carefully. Without talking to your doctor, please do not take these medications. They can increase the side effects of aminophylline. Here are a few more things that you need to tell your doctor before using aminophylline. Whether you have a history of substance abuse or whether you have or have ever had epilepsy, heart disease, overactive or underactive thyroid glands, high blood pressure, or liver disease. Are you pregnant or trying to become pregnant, or are you breastfeeding? Do you use tobacco products? The efficacy of aminophylline can be impaired by cigarette smoking. Interactions of aminophylline with other medicines. The following drugs can decrease the clearance of aminophylline, resulting in increased concentrations of plasma theophylline and the potential for increased toxicity. Fluvoxamine, cimetidine. Antibiotics from macrolide, e.g., erythromycin, clarithromycin. Antibiotics from quinolone, e.g., ciprofloxacin, norfloxacin.
fluconazole, isoniazid/isoniazid. Propranolol, allopurinol, high doses, e.g., 600 mg daily. Oral contraceptives, mexilatin, propafenone, diltiazem, verapamil, calcium channel blockers, disulfiram, interferon alpha, a vaccine for influenza, methotrexate, zafirlocust, Tacrin, thiabendazole. Hormones of the thyroid. Aminophylline dosage. The loading dose of 6 mg per kilogram body weight of aminophylline can be administered at a rate not exceeding 25 mg per minute by slow intravenous injection. The maintenance dose of aminophylline for the next 12 hours can, depending on the patient's condition, be considered as follows. Age dosage. Kids between 6 months and 9 years of age 1 mg per kilogram per hour, reduced after 12 hours to 0.8 mg per kilogram per hour. Healthy, non-smoking adult 0.7 mg per kilogram per hour, reduced after 12 hours to 0.5 mg per kilogram per hour. Patients who are older and with COR pulmonal 0.6 mg per kilogram per hour, reduced after 12 hours to 0.3 mg per kilogram per hour. Congestive heart failure patients 0.5 mg per kilogram per hour, decreased to 0.1 mg per kilogram per hour. Liver disease 0.2 mg per kilogram per hour more than 12 hours. Overdose. If aminophylline is overdosed, it can be harmful. When someone has taken an overdose, extreme signs like passing out or respiratory problems can occur. Note: do not share the drug with anyone. To monitor the progress or check for side effects, lung/breathing and blood pressure tests should be conducted regularly. For more info, contact your doctor. Ignore allergens/irritants that can worsen breathing problems, such as smoke, pollen, pet dander, dust, or molds. Use a peak flow meter daily and record worsening breathing symptoms promptly, such as yellow/red range readings and increased use of rapid relief inhalers. Missed dose. If you use aminophylline daily and forget a dose, take it as soon as you recall it. Don't take the skipped dose if it is near the next dose. Do not double the dose to recover the missed or forgotten dose during the next dose on a regular dose. Aminophylline storage. Store aminophylline tablets at room temperature. Try to avoid moisture, heat, and light. Do not freeze it. Do not store it in the bathroom or washroom. Only flush or dump the drug in the sink if told to do so. Disposal of this product is necessary when it has expired or is no longer required of you. Other important information.
Hold all your doctor and laboratory appointments together to validate your reaction to aminophylline.
The doctor will order some lab tests.
Talk to your doctor about moving from one brand of aminophylline to another.
Do not let the medicine be taken by someone else. If you have any questions about refilling your prescription, ask your pharmacist.
As well as any products such as vitamins, minerals, or other dietary supplements, it is essential for you to keep a written list of all the prescription and non-prescription, over-the-counter, medicines you are taking.
Anytime you visit a doctor or if you are admitted to a hospital, you can carry this list with you.
Bringing information with you in case of emergencies is also relevant.